So welcome everyone to the grand finale of the 3-day sessions that we've had. I want to thank again Chris Coburn and his entire team for all the work that's been put together in making this phenomenal session. What I would add to his selection about these 12 disruptive technology, that if you can only imagine getting 50 Harvard faculty to take 100 possible disruptive technologies and select the top 12 and then rank them in order from 1 to 12, that pain and suffering is only possibly matched by the conviction that we're absolutely right. So should there be any doubt about this, we're willing to go to battle or to moonshot for any of the questions that you might have. Let me turn it over to Monica.
Yeah, so I'm told we walked up here to the theme song of the Dirty Dozen movie. I don't think that's setting the tone for what we're doing today. Instead, this is the fabulous, fantastic dozen. Okay, we're going to start first and by rolling the first video.
Number 12, nanotechnology and cancer treatment. The application of nanotechnology in medicine is an exciting new frontier. This emerging field of bioengineering offers a multitude of interesting structures, materials, and tools that are showing promise in the development of new cancer detection and treatment approaches. In addition, nanoscience and technology are enabling fundamental discoveries in the fields of cancer biology, genetics, and oncology. Nanoparticles so small that they are measured on a molecular scale are being tested to home in on tumors due to their altered vascular permeability and/or the attachment of targeting molecules on the engineered particles, providing novel strategies for cancer detection, staging, and treatment. The combination of nanoparticles with externally delivered activation signals may also provide precise localization to the cancer cell killing effect with minimal side effects for normal tissues. In addition, specially designed bioengineered structures, drug-eluting cages, or even nanorobots could one day carry out complex programs to treat cancer with unprecedented sophistication, releasing drugs under precisely programmed conditions, defined either by complex treatment planning regimes or even molecular probes.
Okay, and I have the great pleasure of introducing the expert in the field of nanotechnology who's going to tell us about applications in oncology, Dr. Omid Farokhzad from Brigham and Women's Hospital. He's a physician scientist, associate professor in the Department of Anesthesiologist, and at the Dana-Farber he belongs to the Cancer Cell Biology Program. Omid.
Thank you so much, Monica. So the impact of nanotechnology in cancer really is very broad, but I would say the key point is really on delivery. And what we've learned looking at a number of therapeutics that have come to traditional cancer treatments, the more molecularly targeted drugs, even platforms like antibody drug conjugates, RNAi, mRNA, gene therapy, the key challenge has always been delivery, delivery, delivery. And what nanotechnology does is it actually allows you to solve these problems in ways that was not possible before. Now, to look at the impact of nanotech, we really have to look at the direct impact of it and then some of the indirect impact of it. So direct impact would be drugs that have come purely by those technologies, and drugs like Doxil and Abraxane have been in clinical use in the mid-90s and the mid-2000s. And more recently, we're seeing targeted nanoparticles in their clinical trials. There's now 7 targeted particles that are going clinical trials. But also the indirect impact has been enabling technologies like RNAi, mRNA treatments. Those are solved by nanoparticle technologies in large part. And our knowledge has been growing really in an exponential phase. And if I look back at the year 2000, the cumulative number of publications on nanoparticle was about 1,200. Every other year, the number of publications has doubled. By 2014, we had 115,000 papers published in nanoparticle technologies. And so my expectation is that as we look at the field over the next 10 or 20 or 30 years, that the impact that nanotech will have in medicine will actually be huge.